Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing programs that can really complete the package of benefits that you offer your prospects and clients. We've asked our partners over at Surebridge to come over and visit with us about their dental, vision, hearing, and hospital indemnity plans that are natural adjunct products to the Medicare market and the folks that you serve, both your clients and your prospects. And so we feel today's presentation will be of great benefit to you. It is being recorded, and the link to that recording will be sent to everyone who RSVP'd for today's presentation, but will also be placed on our website at premiersmi.com and on our YouTube channel. So watch for that. And if you would, mark us as a safe recipient, because sometimes when we send out links and attachments, we'll get pulled into spam filters, and I want to make certain that you get everything you need with this presentation. You'll notice in the software package that there's a place there for both questions and chat. We ask that you put your questions in the question box, and we find that normally we address them all during the course of a regular presentation, but we will make certain that we get you the information you need in the event that we do not do that. One of the things that you'll find as well is we have people with different experiences with our organization, I should say familiarity with it. So let's start with a little bit of background as to who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, working through independent insurance agents such as yourself, with contracts that are available at the highest possible commission levels and recruiting contracts available to those who qualify. And we do so through a full portfolio of products, including the base Medicare programs with Medicare Advantage and Medicare Supplement plans and the standalone Part D prescription drug programs, but also through a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, and on offerings of long-term care and short-term care programs, along with disability income plans. The ancillary benefits, such as what we discussed today, are a big topic for us, and they include dental, vision, hearing programs, critical illness and cancer plans, hospital indemnity programs, accident plans, and we even rolled out a telehealth program, MD Live, a month or so ago. When you look at Medicare Advantage, we have the national carriers there for you within our portfolio, and it has the national carriers, but also some of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the standalone drug programs, the PDP programs, where those carriers are available to you through our organization as well. When you look at the Medicare supplement plans, we have a robust portfolio of programs and different marketing support set up specifically to help you be successful in that space as well. When you look at ancillary products, such as what we'll discuss today, in each of the categories, you have the national leaders there for you. And we find that these programs not only fill a significant need with the people that we speak with, but also offer us unique operating procedures that we can do in terms of marketing and creating an additional revenue stream for our agencies. When we look at Medicare overall, obviously it's a huge market. You don't come on a program like today without hearing of the silver tsunami, the aging of the baby boomers, one every 10 seconds turning 65, 10,000 plus a day. But if you look at Medicare based just on age, based just on 65-year-olds and up, we're missing a part of the overall market. And the fact that particularly over the last year and a half, I wonder why, some people have delayed accessing Medicare benefits because they're continuing to work, and some others are retiring and taking the benefits and going. But it skews the numbers that we see on the Medicare population based just on age. We have to, however, then take into consideration the fact that about 15% of the Medicare population are under the age of 65 and more than offset that number. These folks are also eligible for the programs that we discussed today and make a great market for you. And it's important that we look at the entire situation that our folks visit with, because 2/3 of the population on Medicare have 3+ chronic conditions. So you have needs for hospital indemnity programs, and also many of the things that we see in dental, vision, hearing programs deal with other health issues as well. And about half the folks, I mean, if you look at that median income, they have some challenges with the monies too. So having programs in place that can help them properly budget for some of the things that just happen to us when our bodies age is very important for us to take care of our folks because they have choices. When they get on Medicare, they don't have to do anything at all. They can even decline Part B if they chose to do so. Most don't, thankfully. But we have a number of people that will pick up just a standalone Part D program to help with the medication costs. Some will actually pick up a standardized, modernized Medicare supplement plan, a Medigap program to help with some of the medical expense shortfall. And then some folks will opt into the Part C programs, the Medicare Advantage programs. In each of these categories, we have a population that needs the product we discussed today. And so it's important for us to have that sort of support and that sort of product available for us to address the needs of the people we visit with. What we're seeing too, when people do access Medicare, they're taking pretty much an even split between the base programs of Medicare Advantage and Med Sup. In each category, they need help with dental and they need help with hospital expenses. And so do the folks that are falling into that original Medicare category, because these people, well, they could be Medicare, Medicaid recipients, they could be folks that are accessing care through the VA, they could be folks on a retirement program, or they could be, hey, I'm subsidizing myself, I'm self-insuring. So we want to have that possibility of helping them across the board. In order to do so, sometimes we need a translator. So one of the things you'll see in the follow-up that we'll send is a link to the guide that helps with the acronyms. Been in this business a long time, and every now and then you still see one pop up that goes MICKEYMOUSE. What does, oh, I'm a Disney guy. Well, not really that deep into it when you talk about these acronyms, but it helps to make certain that we know what is being asked of our folks and how we can help translate. Now, regardless of the different election periods, it seems like we just came out of AEP and dealt with OEP, and folks are already starting to look for this fall's annual election period. But the election periods that we have with the Medicare population don't apply to today's topic. They're not locked into dental coverages. They're not locked into ancillary benefits that can help with hospital expenses. And so even the special election periods don't apply to the conversation we have today. But it's important for us to note that working these categories may expose us to folks that are eligible for a special election period and enable us to do a more comprehensive examination of the benefits that are there for them and can create additional conversations. And let's face it, there's a ton of extra special election periods because of weather. I've even seen some on civil unrest, and we see a bunch of those. This listing will come to you as part of the follow-up as well. It's important for us to offer the different types of benefits that we have because, well, as Kaiser Family Foundation states in one of their surveys, over half the population don't review or compare their coverages annually. So some of them don't even know what they have, and it's particularly pervasive in the population that needs it the most. So our availability of getting the information out there and helping people understand what they're reading can make a big difference, because even if they are accessing benefits online, well, most of them aren't. And even the great videos that the government puts out there, if you go on YouTube and look at some of these, you'll see that 1.2, 1,200 views. Well, that's kind of meager considering the size of that population. So the information isn't necessarily getting out there, and it's not getting out there too on the macro legislation and what supplements an individual can qualify for under these types of programs. And it's important for folks to realize that even if they think they've got a very strong Medicare supplement, the vast majority of those programs don't even offer discount programs for dental or additional hospital stays. We also want to make certain that we're able to present the information in the manner in which our audience hopes to receive it. And sometimes that's face-to-face. We're seeing more of that here recently. You also see some folks that are really good at Zoom calls or Join Me or whatever it happens to be. So the ability to offer these programs both face-to-face and on a virtual basis, can really help us satisfy the needs of our prospects and clients, but also give us the opportunity to sell electronically as well. And that's where systems can make a big difference too, because these folks are being trained on proficiency on online activity, and we see it across the board. I mean, I've got a doc that I've seen 9 times in the last year, all over my cell phone, all over that smartphone. And so we see a lot of delivery of services by primary care specialists, physicians, that sort of thing, hospitals. You're even seeing dentists do some preliminary work electronically. And folks are becoming accustomed to receiving the information and care in that fashion. Heck, I mean, even faith-based organizations, a lot of them are still doing services online. So folks are becoming much more accustomed to delivery of information in that fashion. And so we want to make certain that we're able to deliver that information. And so we've asked our friends over at Surebridge, I've invited Mr. Seth Groff to come on and visit with us about the possibilities we have with Surebridge. And at this particular point in time, Seth, I'm going to turn control over to you. And sir, you have the helm.
All
Ladies and
right.
gentlemen, Mr. Seth Groff.
All right. Well, thanks, John, and thanks everyone for jumping on today's call. I think John really, brought a very important point during that opening, in that, right now is a great time to talk to your clients about ancillary products. As he mentioned, you don't have to have a special enrollment period to talk about these products. And right now we're kind of in this lull period, where we're sitting around waiting for the other carriers to come out with some of the more core medical products for the 2020 or 2022 AEP. And so as we kind of sit around and wait, this is a great time to learn about ancillary products and go out and talk to your clients about ancillary products, so that when we get busy prepping for the fourth quarter, we already are familiar with these products and are ready to go out and talk to our clients about how they can benefit them. As John mentioned, my name's Seth Groff. I'm the National Sales Director at Surebridge. And I always tell people that Surebridge is one of the fastest growing ancillary carriers out in the marketplace. Ultimately, we have 3 goals, and that's to offer the best products at the best price, and to compensate you, the agent, fairly for selling them. And the only way we can accomplish those 3 things is by leveraging technology. So when you look at our ancillary products, you're going to see that they're all going to be quoted and applied for on a point of sale tool online. And you're going to have several different signature options. You got face-to-face, you have email, you have voice signature, we even have text signature. But the point is that we're going to leverage technology to make the sales process as easy as possible for both you and the client. And as a result, by leveraging technology, we can accomplish that. Also, when you look at our portfolio, you're going to see products that are going to be guaranteed issue. Guaranteed issue means no health questions. Okay, the prime DVH, which we're going to talk about today, falls into that category. Basically, there's going to be a couple of knockout questions, or I should say not knockout, but eligibility questions, meaning you can't be in jail and you have to meet one of the residency requirements. But as long as you hit those, they're going to be issued. And then when you look at other products that have true simplified underwriting, like our Hospital Indemnity Plan that we're going to talk about today, those are just going to be underwritten based on the questions on the application. So as long as your client can get through the app truthfully and answer those questions favorably, those are going to get issued. So the point is, by leveraging technology and easy to issue products, we're able to issue over 90% of our products policies in real time. And really, the only reason a policy wouldn't be issued is if they already have a plan, or if for some reason they're not going to be eligible. And so that number is actually very conservative. It's probably up over 95% are going to be issued in real time. Your client's going to have that policy, and that protection is going to be begin immediately if they want. Also, I realize that your primary market probably isn't ancillary products. And so Surebridge can be your go-to carrier for ancillary products in both the over 65 and under 65 market. And so, today we're kind of focusing on that senior market, 65 and above, but we got a lot of plans out there in the under 65 market as well. And when you look at this screen, it can somewhat be overwhelming, but really we're going to hone in on two of our very popular products, and that's always going to be a good place to start. The other thing that I always like to point out is that if you like guaranteed issue products, Surebridge has a lot of them available. Now, some of these GI plans aren't available in the over 65 market, but you can see there that anything that has the GI next to it means that there's going to be a guaranteed issue benefit available. And so just take a look at the entire portfolio, especially if you also focus on the under 65 market, because we sell a lot of these plans in both the under 65 and over 65 market as well. And if you're still kind of on the fence about selling ancillary products, I kind of have 4 points that I just like to reinforce the reasons why you should consider it. Number one is client retention. Property and casualty products or agents are going to be a great example of this, right? When they're going out and they're selling P&C insurance, homeowners, auto, they want to get everything, right? Because they know that the more policies that they have with the client, the less likely that client is going to leave them. And I'm a prime example with that. I got my homeowners, I have all of our cars, I have my motorcycle or my boat. Everything's tied up with that one agent, and I'm not going to leave them because I don't want to unwind it all. And so the more policies you sell to a client, so maybe it's a med sup and a prime DVH, or maybe it's a med advantage and a hospital indemnity plan, but the point is the more products you sell to that client, the less likely they're going to leave you. Also, differentiation from your competitors. When you look at the core Medicare products out there, whether it's Medigap plans or Med Advantage plans, and you look at the core carriers, your competitors are going to have the same access to them. And so you can't really differentiate yourself on those products because your competitor down the street can go to your client and say, yeah, I got that too. But one way you can differentiate yourself from the competitors is to offer ancillary products, because I'm telling you, statistically, your competition isn't going to be offering them. So if you want a different story to tell the clients that you meet with, ancillary products are going to be a great way to do that. Obviously, the what's in it for me, you can generate some additional income. Up on the screen there is a pretty conservative pretty estimate as far as what you can make. I tell people if you sell one a week, you're gonna, increase your income about by 10,000. I'll say that, by contracting with Premier, they offer some of the top commission levels in the industry, and so you'll probably, get above that if you're selling ancillary products. But one a week, you do the math. What about 2 a week? What about 3 a week? Or how many clients do you meet with in a year? 100? Well, okay. What if you sell 70 of them, an ancillary product? The point is that you're going to be able to increase your revenue per client by selling these plans. And then finally, your clients need them. That slide up there that John showed, what of the financial situation of a lot of these seniors, they are on a very limited budget as far as their monthly or their annual income, and then also they don't have a lot in savings. And I guarantee you that savings probably isn't there for medical expenses. And so the point is that maybe spending 30, 40 bucks on a DVH or a hospital indemnity plan might make more sense than having to pay for those expenses out of pocket. And so you're going to find today that your clients do need these products. So, when we talk about the senior market and where you should focus, because obviously that one slide, we had a lot of products, and it's kind of overwhelming when you open our product guide and be like, whoa, where do we start? So I always tell agents that focus on the senior market to kind of look at this diagram. If you're selling med sups, look at prime DVH, okay? Because we know that Part A and Part B isn't going to cover dental, vision, and hearing benefits. If you're selling Med Advantage plans, look at Hospital-Wise, because we know that those Med Advantage plans come with copays, and Hospital-Wise can pay the client cash to help offset some of those that financial responsibility. And if you're an agent that just looks at the needs of the client and do a little bit of both, then you're going to definitely want to pay attention to both in today's presentation as well. So first, we're going to start with Prime DVH, which is going to be a dental, vision, and hearing combo product. And up on the slide, when we talk about opportunity, you can see that 65% of the Medicare population doesn't have any dental coverage, right? And so stop and think about that. Statistically speaking, if you work in the over 65 market, chances are 2 out of 3 of your clients don't have dental coverage. So the point is, there's a huge market out there for this, because they all probably have Medicare, right? Or at least a high percentage of them probably already have some Medicare products or Med Sup products or something of that nature, but they don't have dental coverage. So just the number of people that you can go out to talk about this product, probably in your own client database, is going to be tremendous, because just statistically, they don't have dental coverage. And then also, I always like throw this up here. When I talk to Medicare Advantage agents, they always say, "Oh, my, MA plans have dental coverage." Well, okay, a lot of them do. A lot of them have very good dental coverage, but not all MA plans do. So make sure you are looking at your MA clients and seeing what particular plan they are currently enrolled in, and seeing if there is dental benefits built into that MA plan, because there's still a large percentage out there that don't. So make sure you take a look at that. But let's take a look at Prime DVH and some of the highlights that you can offer to your clients. So as I mentioned, DVH stands for a dental, vision, hearing combo product. When we designed this product, we went out and looked at a lot of the competitors in the marketplace. We kind of made a list of things we liked, and we made a list of things that we didn't. And, we copied some of the things that we liked, and we changed the things that we didn't like. And one of the things that we didn't like with a lot of DVH plans out there is that a lot of time for preventative services, you'd get hit with a deductible. It wasn't covered at 100%. So that client went to the dentist and, and still received a bill. And we didn't like that. And so the preventative dental is going to be covered at 100% from day one with no deductible. So that client can go to the dentist, get the teeth checked out, and do that real basic cleaning. On the same light, vision and hearing exams are covered at 100% from day one with no deductible. And so that client can go out, see the dentist, get the teeth checked out, go to the optometrist, get the eyes checked out, then go to the audiologist, get the hearing checked out, all with no out-of-pocket costs immediately after the plan is enforced. And so when we talk about true value and kind of recouping that value for the premium, pay one premium, go get all those services with no out-of-pocket costs, no deductible, which is going to be huge value. Also looking at the other parts of the dental, basic, no waiting periods, and we'll talk about what percentage it's covered at on a later slide. And even the major services only has a 9-month wait. And so again, we just wanted this to be able to use as soon as possible. And then you're going to see very competitive premiums and commissions. And then finally, we'll talk about the networks that are tied to this, and also how out-of-network benefits work as well, because we know that some clients just don't have a provider that's in network. And so we wanted to make sure that even if they go out of network, they're going to have some rich benefits as well. And so issue ages 0 to 90, we do allow child primaries on this plan. So if you kind of work that under 65 market, you want a good DVH plan for a child, this is a great option. It is going to be renewable for life. So that means if they get it issued when they're 90, they turn 91, they get to keep the plan. It's not going to stop as long as they pay the premium. And as I mentioned earlier, it's guaranteed issue, no health questions. The way that it works is that the client is going to select a pool of money. Okay, so they're either going to select $1,000, $1,500, or $2,000. And then all the benefits are going to come out of that pool of money. So the dental benefits come out, the vision benefits will come out of that pool, and the hearing benefits will come out of that pool. If they want to use it all for dental, they can. And a lot of people do that, especially in the under 65 market, just because of the way that it prices. Otherwise, they can, use a portion of it for a dental, allocate some of it to vision and some of it to hearing. And we'll talk about the caps related to the vision and hearing. There is going to be a $100 deductible for some services, and we'll talk about which ones that is applicable. But just remember that the preventative dental and your vision and hearing exams, it is not applicable. And we'll talk about the networks on the appropriate time on the slides. Looking at the dental benefits, I always tell people this is just the short list. My recommendation is to go out once you're contracted through Premier, download the product guide, and in there is going to be a sample policy. Save that sample policy to your computer, and then that's going to have the full list of what's covered and in what category. The two questions that always come up on this slide, and so I just address them right now, is they ask about implants and they ask about orthodontics, right? Implants are not covered and orthodontics are not covered, okay? You know, when you start looking at dental plans that cover those two things, you're just going to see an increase in cost, and really they usually only have limited benefits for those two things as well, and so we did not include those two things in this plan. Other than that, it's going to be very similar to the other dental plans out there as far as what's covered and where they fall as in terms of type 1, type 2, or type 3. The way the payments are going to work, and we kind of already hit on the preventative, no waiting period, 100% deductibles not applicable. If you have a basic type service, so like a basic cavity, there's no waiting period. It's going to be covered at 60% year 1, 70% year 2, and 80% years 3 and beyond, and that deductible is going to be applicable. Your major type services, so like a root canal, has that 9-month wait. Then for the remaining 3 months, it'd be covered at 60%, then it jumps to 70%, and then 80% for year 3 and beyond, and the deductible is applicable. There's only one deductible per policy year. So if you hit it with a type 2 service, you don't get dinged again for a type 3. So just remember that it's one deductible per policy year. Now, up on the screen is how it pays if you go in network. On the dental portion of this plan, we use what's called the Carrington Network. Carrington Network has a wide range of providers. You're going to get some great discounts. Whenever possible, go to a Carrington provider. But like I said earlier, some of you on this call today probably have clients that maybe they live in a rural community, or maybe they have a dentist that isn't in network, and we wanted them to have benefits as well. And so out-of-network benefits utilize what's called a passive network. And the way a passive network works is that it pays these same percentages that are up on the screen. However, the amount that we pay is going to be capped at the 75th percentile of usual and customary charges. And now this is usually when I start to lose agents, okay? It's not 75% of usual and customary charges. It's capped at the 75th percentile of usual and customary charges. So the way that I try to explain it to agents is that imagine that there's 100 dentists standing in a line. They all charge a different amount, right? As long as you go to dentist 1 through 75, it will pay the same as if you go in network. If you go to, a dentist that's in the upper quartile as far as most expensive, then it's going to be capped at what that 75th dentist charges, okay? So just be advised, that's how the out-of-network benefit works. But as I mentioned, they still get some pretty good benefits. I was explaining a claim to an agent earlier, well, actually it was yesterday, and it did hit that cap, but it was like $6, right? So the approved charge was like $193, and the dentist had charged $200. So not really that much difference as far as going in network, out network. So as long as your dentist is reasonably priced, there's not really going to be that much of an issue. But like I said earlier, go to a Carrington provider. There's a lot of them out there, and you're going to receive some good discounts when you do. When we take a look at the hearing benefits, it's going to cover hearing exams, purchasing hearing aids, repairs. But one of the things that is often overlooked and can really provide some true savings to your client is the savings they get by going through a true hearing provider. So on the hearing, we use the True Hearing Network, and you can see that it's 30 to 60% savings on hearing aids if you go on some hearing aids, if you go to those providers. And if you're not familiar with hearing aids, they can get expensive. So it's not uncommon, $5,000, $6,000. So now when you start throwing on 50% savings on $6,000 hearing aids, that's some true value that you're going to see with this plan. So don't overlook the savings that they get by going to a true hearing provider. And then vision benefits, going to cover eye exams, contact lenses, frames, lenses, corrective spectacle lens fittings, follow-up visits, things of that nature. Now, the thing you have to remember about the vision benefit, I'm going to really stress this in today's presentation, is it's not tied to a network. Okay, we wanted the client to be able to go to any vision provider they want. The way that it works is that they would settle up with that provider, and then the client would come and submit the claim directly to Surebridge, and we would reimburse them for any benefits. So just remember that the vision benefit is not tied to a network. Go to any provider, settle up with the provider, and then submit the claim directly to Surebridge for a reimbursement. But looking at, how the vision works, we hit on the exam, covered immediately, 100%. The hardware does have a 9-month wait, so make sure that the client is aware of that. And also that hardware is going to be subject to the deductible. If they already hit it on the dental portion, they don't have to pay it again, but just keep that in mind. Also, the maximum vision benefit is going to be $200 a year. So even if you have a $2,000 benefit, you only can use $200 for the vision portion. So keep that in mind. The hearing is going to work very similar. The one thing that I always have to point out about the hearing is that it's going to be capped at $500 every 2 years. And the reason we designed it that way is, because those hearing aids are expensive. And clients don't buy them every year, so you can go buy them $500, and then you wait 2 years and you get another $500 if you need it. But remember, you can allocate it all to dental if you want. But then, just like the vision, that hardware does have a 9-month wait, then covered at 60% for the remaining 3 months, then 70% year 2, 80% years 3 and beyond. And the deductible is going to be applicable as well. But just remember, one deductible per policy year. So that's how the vision and hearing benefits are going to work. As far as monthly premiums are going to be concerned, you can see up on the screen what the cost is. What I always tell people is that these are issue age premiums. And so, once you get locked into a premium or an age band, you're going to pay that age band premium for the remainder of the policy. So if you're working that turning 65 market, or if you have some clients that have recently turned 65 and you haven't talked to them about DVH, I'd reach out to them and let them know that they need to get that rate locked in before they turn 66, because once they turn 66, they jump up in the age band, and you can see that it's going to end up costing them, maybe over $100 a month, depending on what benefit they get. The other thing I always point out on this slide is increasing benefits. Okay, so everybody always asks about increasing benefits. We only allow an increase of benefits on the policy anniversary. Okay, so 90 days before the policy anniversary, you can go out, submit a new app, enter in the policy number, but you have to select the effective date as the policy or for the effective date of the change for the policy anniversary. Okay, that's kind of how we protect ourselves from anti-selection and somebody just sandbagging, buying $1,000 benefit until they need care and then increasing it. So just remember, if they want to go up, they have to wait until the policy anniversary in order to do that. Now, the good news is they don't start new waiting periods, so that is one good thing, but they do have to wait until the policy anniversary. A couple frequently asked questions. Will your client receive an ID card? If they're over 65, yes, they always receive an ID card. If they're under 65, it depends on how they answer a question on the application. There's a question on the app that says, do you consent to electronic delivery? If you say yes, they will not receive a card in the mail. They'll just receive instructions on how to go out and download it. But just answer that question no. There's no penalty for answering no, and they'll receive the card in the mail. And right there on the screen is what it's going to look like. If they want to find a provider, I always point them to go out to ChesapeakePlus.com. Right down here in the lower right hand corner, you can see find a dental provider, find a hearing provider, click on that, enter your zip code, and you'll be able to find a provider. Don't get confused with this find a vision provider. This is for a standalone vision plan that we have. This is not applicable to Prime DVH because, as I mentioned earlier, Prime DVH does not use a vision network, and so this is not applicable for Prime DVH. This is a standalone vision plan. But the other thing I'd like to point out is get an ID card right up here. If your client wants to get an ID card before it comes in the mail, you can come out here, download it for them. Actually, the client can come out and download it too. You don't need to register up here. Just click on this link, get an ID card. You'll have to enter in some basic information that you have, and you'll be able to do it. Also, some other good things you can do right out here on the self-service tool as well. So this is going to definitely want to be a website that you download. What should the client say when using the card? So, it's Surebridge, underwritten by the Chesapeake Life Insurance Company, and then the dental portion uses the Carrington Network. And so sometimes there's some confusion for the client. When they go to the dentist, make sure they say Carrington Network. Okay, if you say Surebridge or the Chesapeake Life Insurance Company, the dentist is going to be like, we don't take that. But the Carrington Network, they're going to be familiar with it. It's big enough. They'll know who it is, and then it'll just be a lot easier. obviously with the hearing, say true hearing, and from a vision portion, I tell clients don't even say they have insurance, because remember, they're going to have to pay the provider and then submit the claim directly to Surebridge for reimbursement for the vision benefit. The dentist will file the claim if they go in network. If you go out of network, it just depends. Some dentists will file it, some won't. If for some reason the dentist won't file the claim, the client can still submit the claim directly to Surebridge and they'll be reimbursed. Same is true with the hearing. That's the same way that the hearing works. And then again, remember, vision will always be a reimbursement. Okay, so they settle up with the provider, then submit the claim directly to Surebridge, and that's how that's going to work. So, 3 sales ideas for the prime DVH in the over 65 market. I always just say, we'll let the government sell for you. Medicare and You handbook. People turning 65 get this, have it on the coffee table when you go out and meet with them. Flip to this page, I believe it's 57 or 59 in the Medicare and You handbook, and it just outlines what's not covered by Part A and Part B. And it says right here, most dental care, eye exams related to prescribing glasses, dentures, and then hearing aids and exams for fitting them. So you just need to make sure that they are aware, if they're enrolling in Part A and Part B, that that they don't have coverage for these. However, you have might have a cost-effective way to pay for these care with a prime DVH plan. Then once you get done with your Medicare sale, you can circle back and educate on prime DVH. My other sales technique for you is just ask, are you currently going to the dentist? Okay, because regardless of how they answer this question, you will be able to have a conversation about prime DVH. So, are you currently going to the dentist? And they say no. You just ask, is that something you're interested in? Chances are they'll say yes. They know they need to go to the dentist, and you just say, oh, great. Let me show you a cost-effective way to pay for your dental care. If you ask them if they're currently going to the dentist and they come back and they say, yeah, I am going to the dentist, you say, great. Are you paying for that out of pocket, or are you using insurance? If they come back and say, well, right now I'm paying for it out of pocket, you say, oh, let me show you maybe a more cost-effective way to pay for dental care. If they come back and they say that they are going to the dentist and they do have insurance, you say, oh, great. Just out of curiosity, does your current plan also provide vision and hearing benefits? Chances are it doesn't. And then you can go into prime DVH and show them a plan that does. And if for some reason they already have a a DVH plan with a different carrier, take a look at it, just compare it, see if Surebridge can provide some better benefits. Point is, regardless how they answer, you're going to be able to have a conversation about prime DVH. And then finally, I always tell people, know your numbers. Inevitably, every time I give a prime DVH presentation, there's somebody in the crowd that will say, I don't believe in dental insurance. And their argument is that you're paying a premium to insure a small amount, right? So you're paying a premium to only insure $1,000, $1,500, or $2,000. But the thing that I always tell people is that dental insurance and vision insurance isn't like other insurance, in that you don't have to wait for a catastrophic event to occur before you get to use it. You get this plan in force, you can go to the dentist, right? You get this plan in force, you can go to the optometrist. And so right here on the screen are going to be, all these services are covered under the preventative services. So no out-of-pocket cost, no deductible, $303. So client goes, pays one premium and goes, let's say it's $30. They pay $30, they go get $303 worth of services. That is not like other insurance plans out there, right? Where you got to wait for something bad to happen. That's what's a good thing about dental insurance, is that there's preventative benefits built into it. And so you can recoup some of that cost that you pay for the premium. So always like to point that out on that. But that's the prime DVH plan. And if there's one product that I would talk to every client about, it's prime DVH. I'm not saying every client needs it, but I would definitely be bringing it up because most people are familiar with dental insurance. They know they should go to the dentist. And if they don't have insurance, they probably hesitate going to the dentist. So both under 65, over 65, great plan for your clients. Last product I'm going to talk about real quick is going to be Surebridge's Hospital-Wise plan. This is great for individuals selling Med Advantage plans, because we know that when you sell Med Advantage plans, you're going to have some out-of-pocket copays, okay? And up on the screen there, more and more people are enrolling in MA plans for the cost savings. However, there is going to be some out-of-pocket costs associated with that. You can see what the average is for in-network services and out-of-network services. And when you end up in the hospital, you're usually going to come out of there with some significant costs. So the point is that there's a need for these plans out there, and there's plenty of people that will have that need. But the way the plan works, issue age is 0 to 90. Again, get that plan in force, and it's going to be renewable past 90. True simplified underwriting, accept, reject, answer the questions on the app favorably, truthfully, you're going to be good to go. No MIB, script check, phone interview. So quick, easy to get these issued. Pre-existing conditions, there is a 6-month look back period for the first 6 months of the plan. So let's say you were broke your arm 3 months before buying this plan, and then something happens and it gets infected and you're hospitalized, and it was 3 months after you purchased this plan, it wouldn't be covered. So pre-X's have a 6-month look back for the first 6 months of the plan. Other than that, there's no waiting period. There are going to be some knockout conditions, which I'll show you a slide on that later, but other pre-existing conditions that we're not worried about, there is that 6-month look back for the first 6 months of the plan. This policy does have a one-time application fee. There's only one app fee per policy per application. So if you're enrolling multiple products or multiple people are enrolling on one app, they only get hit with that one fee. But the way that it works is you start with a daily benefit. You can see there's a wide range of values, but we really wanted you to be able to customize this for your MA client. So you're going to be able to dial that daily benefit in to match what their copay is in $50 increments. And then also there's flexibility in the benefit period. So maybe they have a 5-day copay, maybe they have a 6-day copay, but there's some flexibility there by either going with a 3 or 6-day. But first you do select your daily benefit that's going to pay with their confined to the hospital, and then you select their benefit period. Observation benefit built in, you hit 12 hours of observation, pays just like you were admitted in the hospital. You don't get a double dip on that. So if you're held for observation for 12 hours and then they admit you, you're only going to get one daily benefit there. And then also mental nervous benefit built in, where a lot of our competitors actually exclude that, but will pay up to $250 for a maximum of 7 days. If your client qualifies there. But after you select the daily benefit and benefit period, now it's time to look at riders, okay? I'm gonna just real quick go through the ones that are probably applicable to this sale. Lump sum, you're gonna see that more sold in the under 65 market, just, pays that the first time they're confined to a hospital. Typically sold in under with high deductibles, high co-insurance to help eliminate that. But that one, you're probably not going to sell in conjunction with MA plans. Outpatient surgery rider is going to be one that you want to take a look at. Pays that the benefit they select twice per year for outpatient surgeries resulting from sickness or injury. So that is going to be one you're going to want to take a look at. Skilled nursing facility rider, again, is going to be one you want to use. A lot of MA plans are going to have that copay for days 21 through 100. So we can align the copay with that particular benefit period to keep costs down. And so this will be one that you want to add. Emergency care rider, this is one of our more popular benefits just because it's very affordable. Pays if they go to an ER, it does have to be an ER tied to a hospital due to sickness or injury, okay? So they're not feeling well, they're sick, it's late at night, they end up at the ER, it pays, okay? Or if they get hurt in an accident and go to the ER, it pays. And they don't have to be hospitalized in order to receive that benefit. So they just go to the ER, boom, they get that benefit. Ambulance rider pays that if they take a ride in the ambulance, and major diagnostic rider pays that when they have one of those one of those exams listed there. So these three are going to be ones that you will sell in conjunction with MA plans. There is a wellness rider, but it's kind of expensive. I don't recommend selling it. It's just going to be kind of exchanging dollars, but I always point that out so that when you see it out there, when you're running quotes, you know what it is. But really, here's how you're going to sell this plan. On the left, it's pretty common. MA plan, $285 copay for hospitalization for 5 days. We got a copay for outpatient surgery, emergency care copay, ambulance service, skilled nursing confinement, and major diagnostic exam copay. So this is going to be pretty common what you're going to see with an MA plan. And then over on the right-hand side, you can see that we were able to cover most of these copays with a hospital-wise plan. So we did $300 a day with 6-day benefit. Outpatient surgery rider, line that up. Emergency care rider, we bumped that up to 200 just because of the low cost. Ambulance rider, line that up. Nursing rider, we did $200 a day for days 21 through 100, and major diagnostic rider of 200. Remember, this plan does not coordinate with that MA plan, okay? It's going to pay the client directly the entire benefit. So even though, you know, they're covered on that 6th day with this MA plan, we're still going to pay that $300 a day to that client. So this pays the client cash. They can use it to pay these copays or whatever they want. And we were able to get Jane a pretty good plan here for only $54.04 a month. Now there's a wide range of opinions as far as what you're going to, you know, how much these clients can afford. This is just an example of like the best to cover everything. If it's too expensive, start dialing down benefits. Something is better than nothing. And so if you show them this, say, I can't afford $54 a month, say, okay, well, maybe we'll do $200 a day for 3 days, right? And so you start dialing down the benefits, so at least they have some coverage if they can't afford, you know, a policy, a real rich policy like up on the screen. One of the advantages of writing this with Surebridge is utilizing Surebridge's hospital-wise senior plan builder. What this does, it's right here in the quote tool. What it does is it allows you to select the plan or the carriers based on the zip code you entered, and then the plan. And it actually will show you what the copays are and a recommended Surebridge hospital-wise solution. And there's a button here now that you can click on quote, and then it automatically quotes it to you. So we're making it as easy as possible to present this to the client, because basically all you have to do is pull up the plan, the MA plan you're selling, and then it'll automatically quote it for you. So making it as easy as possible to present this. And if I have one sales idea for you, use this tool. Print this out and show them it and just say, hey, here's your responsibility, here's a possible solution, and go from there. Up on the screen there are going to be what the knockout conditions are. Be sure to look at what the look back or the look back period is on these, treated or diagnosed. Medication does mean being treated. So if you have a heart attack and then you're on heart pills, you're still on being treated for that. So keep that in mind. It's treated or diagnosed with any of these conditions, it would be a knockout. Other than that, you know, the last 4 tips that I have for you for selling this plan. Number 1, utilize the hospital-wise senior plan builder. Okay, use that tool. It's in the quoting software. It's one of the great advantages of Surebridge. Makes presenting it easy. Number 2, customize a plan. Don't try to do a one size fits all. Really look at the MA plan you're selling and customize a plan to align with that. Also, if it's too expensive, adjust it, right? And that, you know, falls into keep premiums within their budget. I don't see too many of these plans sold with premiums over $60, okay? There's some people that are trying to keep it between 30 and 40. There's others that try to keep it between 40 and 50. There's some that try to keep it between 50 and 60. But just remember that, you know, you get much over 60, there's just a lot of seniors just can't afford it. And then finally, be ready to pivot, right? All you're doing is educating them. If they come back and say, no, I'm not interested, you say, great, just, you know, get your MA sell and move on. So with that, John, that's what I had prepared for today. I will turn it back over to you and let you wrap it up.
Well, actually, Seth, we've got a few questions I'm going to throw at you here.
Okay.
First one deals with the maximum payment for a year. It asks, if you do not use the full amount during the calendar year, does the remaining amount roll over?
The remaining amount does not roll over to the next year. So it is just going to be for that year. And it doesn't roll over. The one thing I will say about the benefit periods is that they do reset. And so if you're not hospitalized for 90 days, then you do get that benefit period to restart. So like if you're, you know, in the hospital for 3 days and you or let's say you're in the hospital for 10 days and you had 3-day benefit period, but then you're out for 90 days, you do get a reset of the benefit, but they do not roll.
Okay. Next couple deal with someone missed one of the slides on the Carrington network. We'll put in a link to that as part of the follow-up, but there we go. Another question is, do you say hearing aids? Did you say hearing aids covered at 50%, but the max hearing benefit is 500 every 2 years? I think it's a question of how much.
No, Yeah, so on the if you go through True Hearing, you can get discounts from 30 to 60% on some hearing aids. And so what I was saying is that, if you get a 50% discount on $6,000 hearing aids, that's some pretty significant savings. But that's just the discounts associated with the True Hearing Network. The benefit itself is just going to be $500 every 2 years. And remember that it's 60% year one, 70% year two, and 80% years three and beyond. But it's of the cost. But it's always going to be capped at that $500 every 2 years.
Okay. Next question asks if the hospital-wise program has a GI period for those turning 65.
It does not. We wanted to make sure we kept the cost down, and so there is not a guaranteed issue period for the hospital-wise.
Okay. And then the next one is a question, I think for me, pretty much asking if folks are going to get a copy of the slides. Yes, you are. You're going to get a follow-up that has the PowerPoint put together and a link to the recording of today's presentation. So that said, Seth, that handles the questions. I'm going to pull the screen back and wrap up, and I thank you for the presentation. So as Seth mentioned, you have a multitude of ways of making this program work for yourself, not only as a marketing tool, but also as a key component in covering the needs of the folks that you visit with. And so we look to make certain that we help support your needs as well here at Premier. And some of the things that we do are making the contracting process fairly simple. We follow the electronic contracting process for Surebridge, but there are a number of agents that will create an agent profile in the assurance-based software system on our website. So they have a focal point for all the information they need for different contracts, including E&O, answering some of the questions, and it'll do some electronic fill on different contracts for you so you don't miss anything in that process. We also offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? Well, you got a contract with us. But this is a program that you own. So it's not adding you to a blanket E&O for just one policy and you wonder how you can cover the requirement for all the other carriers you have elsewhere. This is something you own. And we find that there are very few companies out there now that are an insurance product that don't require E&O. This will help you in that area. And it's a program you own and takes care of you regardless of whom you contract with for different insurance products. We also offer discounted continuing education courses through our association with WebCE and offer a program where you can take out disability income insurance on yourself on a modified guarantee issue product that you get paid commission on so you can enhance your own benefit package as well. Much as where today's presentation is being recorded, past presentations have been as well. We've got a generic presentation on selling dental vision hearing programs, but we also have different programs out there on how to market in the community, and offering a webinar or a seminar on dental vision hearing products or on hospital indemnity programs are a great way to ingratiate yourself in centers of influence in the community. And we have a number of programs out there that help you become comfortable with that and follow sales tracks to get that done. One of the things we do offer to our agents without cost is access to the electronic tool system that we have, the Medicare Center program, which I did a very long webinar on it yesterday. I apologize for that. A link will come as part of the follow-up to today's presentation on this as well. But you have a single universal login to access 3 different quoting systems, a CRM, a learning center, all sorts of material out there that can help you market compliantly and do so efficiently to add to your most valuable resource, which is your time. And one of those tools in there, the CSG tool, gives you a way to fill in the gaps, so to speak, on some of the programs that are out there. So we'll run into a household sometimes that'll have a Medicare Advantage plan in place. They're happy with it. They won't change it, but it does have those hospital copays and some other things that come into play. This is a way you can use this system to fill in those gaps, and you can use Surebridge program to build a program as well. But this gives you an opportunity to fill in those gaps using this tool system which you use for quoting med sups and all kinds of other wonderful things as well. Seth mentioned the fact that if you have multiple products in a household, it drives up your persistency and your customer retention. It's important to note that the more products you have in the house, the higher your retention. But keep in mind, they don't have to be with the same company. They just have to be with the same agent. That's you. And the neat thing about this is that way, if you got a Med Sup or a Medicare Advantage plan, more likely, and you're offering hospital wise or Surebridge's DVH program, it's going to help drive up that retention. And frankly, that's our salary year over years, our renewals. We do offer a place on our website that gives you an idea of all the incentive programs that are available to you through the different carriers that we offer. A great way for you to go to one place and look at the different programs that are available to you to make certain that you're receiving the maximum value out of the sales that you put into play. And those can help you qualify for Premier's incentive programs as well. We do offer you an opportunity too to use different lead programs to get in front of people. Seth mentioned that the premiums on a lot of the programs go up, and specifically the DVH program from 64 to 65. So we're seeing a number of agents that use dental as an approach for the T65 market. This gives you an opportunity to have a contact list available to you at minimal or no cost, depending upon your contracting situation with us, to prospect in that fashion. A great way to differentiate yourself from some of the other folks that are dialing people as well. And it rolls into some of the things that you have available for community-based programs then too. We hear a lot of talk right now about what's going on with Walmart and some of the other retail programs that are out there. We've done some recent information dissemination on that as well. I'll make certain that we kick to you the detail on the latest that we have on that to make certain that you realize these are health programs and something that can be discussed off a scope of appointment. So using that regulatory tool to prime your conversation, even in a retail setting, can be most helpful. And as I mentioned, doing different presentations to centers of influence in the community, including faith-based organizations, dental's a hot topic. Making people aware of their out-of-pocket exposure on a hospital stay, that can really help you ingratiate yourself into the community, establish yourself as a subject matter expert. And that same thing can transfer over into provider marketing, because how do you market dental programs? Well, sometimes it's through dentists. That's a provider. We have ways of helping you walk through that system to make it an effective part of your marketing program. And you can do that live or virtually, much as anything else. Many of the carriers do offer different prospects, particularly in the Medicare Advantage world, and those can be great prospects for you for dental, vision, hearing, and hospital programs as well. We do have internet and direct mail support as well, and a referral program that gives you hints and tips on how to use that. You'll have a link to that as well. When we speak of the lead programs with the mail, well, there's two different programs that come into play, deeply discounted based on the production that you have with our organization in different categories. So the health programs have one mail program. There's another one for final expense as well. You can qualify for both if you do the business. And we do so through preferred lead vendors because we vet those organizations. We also make certain that the information going out keeps you in compliance. You want to drive up your return, obviously, but we want to do it in a fashion that doesn't put us in hot water. We also have programs that help you with untouched, fresh direct mail responses, a little less expensive up front than a direct mail campaign, not necessarily quite as fresh of leads, but two different systems that can come into play to help you purchase responses. This can fill in some of the holes in some of your marketing material, or could be a great source for you on an ongoing basis. Those internet leads are Facebook based, and there are two programs, one for final expense and one for Medicare. So those are available to you as well. That that referral program, can't emphasize it enough in the fact that, hey, you've got a book of business. If you've used Medicare Center, you've got a system in there with that CRM that you can go back and offer them dental programs. You can go back and fill in the gaps on hospital stays and ask for referrals all the way through that process. So all said and done, what we're looking to is help each other grow our business. And we want to do that with you. And we feel that Surebridge's portfolio of products can help us grow that business. And we look forward to being able to do that together. We also want to be referable. much as everyone else. So if you know of folks that need the programs that we offer, the agents that are out there, hey, send them to us as well. We appreciate the referrals. All that said and done, I think you can see the value of these programs, and putting them in play as part of your personal marketing plan can make a huge difference now and moving forward. And it's like John Wayne says in the movie The Cowboys, slap some bacon and a biscuit, saddle up, let's ride. We're burning daylight. We can put it in play now. That said and done, you can reach us at a number of different fashions. Our toll-free number at 1-800-365-8208. You can respond to the emails that we send out and the follow-up of this. You can go to our website and contact us there as well. I'm going to check the questions one more time before we cut off. No, we're good. Want to remind you that you will receive follow-up on today's presentation, including a copy of the presentation itself in a PowerPoint fashion, slide deck, whatever you want to call it, but also a link to today's recording. All that said and done, a little over an hour. I want to thank you for the investment of your time with us today. I want to thank you for the business that we've done together moving in the past and moving forward. Deeply appreciated. And until we have an opportunity to speak with you again, I wish you good selling. Thanks so very much. Thank you, Seth, for your presentation. And we look forward to visiting with you all in the very near future. Have a great day.